Hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much, as always, for taking the time to be here, guys. As always, I'm so grateful for all the support. And here, by the way, is in sunny Orlando, Florida. We are at Vision Expo, and I'm here with one of my absolutely amazing friends, Dr. Faten Edris. And we're going to be having some pretty amazing conversations today about implementing new technology into your practice. We're going to talk about what are some of the pain points for optometry right now and how can optometry and industry work together better. Before we get into it, I want to say a big thank you to our partner for this episode, Chiveta, which is an organization that's bringing optometry and industry together to work and collaborate better. So big thanks to Chiveta and my beautiful, amazing guest, Dr. Faten Edris. If you don't know her, she is a Miami-based optometrist, owner of 8 clinics in the Miami area, residency trained at none other than Bascom Palmer. And most importantly, she is a mom to 2 beautiful girls. Thank you, my friend, for being here.
Thank you so much for having me.
I know we've been talking about it for so long, and I'm so glad we're doing it. And more importantly, I'm glad we're doing it live in person. This is always so much better.
I know. I wanted it to be live in person, and this worked out perfectly. So thank you for having me on your show.
My pleasure, my pleasure. Okay, so let's start with, for those who don't know you that well, can you give us a little bit of an introduction to who you are and what you do?
You did an incredible job introducing me, but I am, as you said, first and foremost, a mom of 2 girls, young girls. I'm an elder millennial, so I'm trying to crack this life as a millennial, as a mom of 2, a business owner, and promoting doctors and optometrists to break those barriers that we've had for the last 50, 60 years that's been set out by some of the older generations, and what we can set out as the new generation and how optometry can be faced and shaped by us.
Yeah.
So that's been my mission the last 5-10 years.
I love that. And I definitely think you are breaking a lot of those barriers. You're definitely pushing a lot in industry to create these different relationships. Your face is like all of it. She's the face of like EssilorLuxottica, the face of Cooper Vision. I'm not even we're not branded by these companies, but Faten's face is there. And it's not to say her face is just there. She's built these really, really deep relationships with these organizations to the point that she become the face of them, at least temporarily.
I used to be the faces of them, so I'm not anymore, but yes, absolutely. Yes, it's been great.
Let's talk, I wanted to start, not to start negatively, but I want to start with what do you think are some of maybe the pain points right now for optometrists, whether in Canada or the US? I know obviously you're based in the States, so most of your perspective is going to be from the US, but what are some of the pain points you think many ODs are feeling these days? US
and Canada, we are somewhat similar, but different in what you were saying in terms of payments and in terms of rights and boundaries. But about 5-6 years ago, I started to notice that a lot of what we do, a lot of what we practice is shaped by people who are not doctors, right? So a lot of regulation and a lot of industry standards are set true by some regulatory boards that are doctors, but for the most part, industry is what really shifts and shapes our practice and the way we practice. And a lot of us weren't really sitting at those tables. We weren't voicing our problems. There was a lot of what's happening on top and a lot of executive decisions. And then the doctors here, we were kind of getting the end of everything. And by the time those procedures and policies were kind of put out, it was too late for us to get involved. So I felt that a lot of the barriers that we were feeling was because we were the endpoint and we weren't really sitting at the table. We weren't there. So, when you said built and these deep relationships, I started to realize, hey, we got to have some of these hard conversations and start breaking some of those barriers, be it reimbursement or patients not seeing us as primary care providers, or changing the public idea of what an eye exam is, not just glasses and contacts, which has been shaped by industry, that's what our profession is, just glasses and contacts.
Right.
And we really need to start changing that.
That for sure is something that is across the board, Canada and the US, that perception of what optometry is.
Yep.
And it needs to change no matter what side of the border you're on.
That's the thing. Who better than us, right? Who better than the doctors who are actually in the lane, the doctors who are actually practicing? And for us to invite industry leaders to say, hey, why don't we have this conversation? You're trying to set this out. I'm here giving you valuable information of how you can bring your technology or your policies let's come together to make it better, not just for the doctors, but also for patients.
Yeah, absolutely. I mean, ultimately, it's got to be better for the patients at the end of the day. We are healthcare providers. At the end of the day, that's got to be the bottom line. One of my friends who was on the podcast a little while back, Dr. Wes McCann, he says he's got his 3 Ps, which I love. It's what kind of guides him, sort of his North Star with every decision he makes, whether he's in the clinic or he's buying equipment or whatever. So it's patient, practice, profession. So he tries to think about all 3 of those things. It starts with the patient, but then what's good for the practice, and then what's good for the profession. Because there's a lot of decisions. We were saying a little bit offline there, sometimes there's people out there who are making decisions that are a bit more selfish, and just for me, less about what's going to be good for the whole profession, right?
Right.
So I think that's amazing that you're doing that, because what you're doing is going to be good for the whole profession, and it is going to trickle down, and it's going to be good for the patient at the end of the day.
I had during my residency in optometry school, she taught me when I was there, she said, always do right by the patient. And if you always stay true and do right by the patient, you will change and you will make a difference. So that's always, it's great that you said that analogy of the 3 Ps, but changing profession has to come with keeping the patient at the center and the core of how we practice. So,
on that, like, the thing is, I shared this in an episode I just did, but about reimbursements and appropriate compensation. It's hard to provide the best care if you know in your heart you're not being compensated appropriately. I know I'm kind of broaching a bit of a tricky conversation here, but I've said this pretty clearly on the podcast before, and I'll say it again. This is about, I talk about setting fees appropriately, and it's not to gouge people. It's not to line our pockets. It's not just so I can go buy a fancy car. It's because I want to be able to take the time with that patient, sit there, look them in the eye, have a heart-to-heart, know I'm taking the best care of them, and then know I can still keep the lights on, right? Because if I'm spending an hour with you and I get reimbursed inappropriately, I can't keep the lights on, I can't keep providing patient care. So I think that's an important thing for all of us to keep in mind, whether you're billing privately or whether it's through insurance plans or whatever it is.
So honestly, that is a very tricky discussion, but that is exactly what we need to kind of do is for the longest time, insurance companies have seen optometrists as not physicians, right? So I'm not going to go into regulations and all that, but for the most part, as a profession, we're treating patients more than just refractions, more than just contact lenses. Here's your glasses and here's your contact lens prescription, which a lot of it for the last 50 years has been shaped by the reimbursements. Well, if we start to change that discussion, if we start to say, hey, we're now changing how we care for patients. Our exams no longer are just refractions and contacts, here you go. Now we're doing actual treatment of diseases of dry eyes and diabetes and macular degenerations. We've got some of the great optometric, physicians nationally and in Canada talking about the importance of us being involved in patient care and their medical care. But we need to have insurance companies believe in that, and we need to have some of those discussions of, we can take care of patients. We're allowed to, we're there, but let's do it properly where we're compensated properly. And we have to change behaviors too, patient behaviors and insurance behaviors.
Absolutely. So much of that is happening in Canada right now. We're trying to expand scope, or modernize our scope, optimize our scope. We don't like the word expand scope because it seems a bit territorial and aggressive, but modernize and update our scope to what we've actually been trained. You trained at Bascom Palmer of all places. Like, you are a highly trained medical professional, right? But unfortunately, the system hasn't caught up to that yet. We need to educate insurance companies and legislators and all these people to show, look at what we can do. And again, this is what I love that you're doing. And I think we just need to get more of our friends. I'm a bit rah-rah about this, right? I want to get more of our friends on board with this. You don't have to go to Capitol Hill and do that, but you just need to show the public and show people around you that you care about what you do. Tell me a little bit about, as short as you can make this, some of the struggles that you went through starting from the beginning of your career to where you are now. What would you say 2 or 3 things that really shaped you to become the business owner that you are now?
Having the grit and the guts to say, I'm going to change the way we practice, and realizing that I can't do it, like you said, going to Capitol Hill, right? I can't do it within some of the organized groups out there to change. And I thought, exactly you said, I need to elevate patients, and I need to show patients myself how we can be a different provider for them. I did train at Bascom Palmer, and I realized, what good am I as a Bascom Palmer trained doctor if my hands are tied because I can't do a certain disease, whether it's legislation or whether it's insurance compensation. So I said, you know what, we're gonna do it differently, and we're gonna treat patients within settings that have done it differently, And we broke those barriers. I've been with SE Lux for the last 10 years, and we changed some of that narrative of, the stigma of being corporate. We changed what it means to get your eye exam, and we're continuing to do so by investing into our practices. We're all independent doctors, so we're investing into the medical model. We're investing into our doctors who want to practice more. They want to do sclerals, they want to do dry eyes, they want to do disease managements. I have one of the most famous doctors on Instagram and part of my practice, and he wanted an OCT and I brought it in. I said, we'll do it, right? So again, the OCT is going to help the patients, and those patients that are coming in our settings are saying, wow, this is no longer just glasses and contacts. I can do it all here. So by shifting patients' minds and doctors' minds, we can do a little bit of change. And as egotistical as it sounds, I do hope that we've created some change.
That doesn't sound egotistical at all.
Our settings.
I think you have, and I love that. Because we didn't mention off the top that you are what we would classify as, if you're listening, quote unquote, I got air quotes up here, quote unquote, a corporate doctor, right?
Correct.
But we know, you and I know, because I have a sublease as well, I understand it's not what people think of as a corporate setting.
Yeah.
We're independent doctors, and we practice to the fullest scope that we can. Like same as you, we do sclerals and ortho-K and glaucoma management and dry eye and all this kind of stuff. And it's up to us to invest in that, to make our practice what we want it to be, and show the public what we want them to see about optometry. Okay, so you've invested in all this equipment. This morning, you did a talk on an exciting new technology in the dry eye aesthetics space. And you've invested in this equipment in your practice. Tell us about what's gotten you excited about dry eye anesthetics. And, what I really want to get into is, somebody can say, well, Faten, you're a successful doctor, you have all these practices, you could just buy a shiny piece of equipment and say, I have it. But really, we want to talk about the implementation of that. So tell us what's exciting, and then let's get into how the steps you went into implementing that technology.
So, it's funny because a lot of people can just buy equipment, right? And you'll just buy the equipment, you'll throw it in your office, and it'll just collect dust. And I've seen doctors so many times lose on equipment and lose and say, this didn't work for me. Well, did you correctly implement it, right? So yes, I have multiple practices, so the cash flow may be there for me to invest into the business, but I'm also, at the end of the day, a businesswoman. And so I look at where the ROI is, and if I'm bringing this, how can we implement it so we can get the most amount from this? And the implementation is really believing and trusting in your doctors and believing in that mission. So saying, hey, we're bringing this equipment to help you practice better as a doctor, right? And I know one of the questions today was, well, how can you get your doctors to believe in this, right? You're not the one practicing.
That's a big one.
That's a big one. Well, we're doing this because we believe that our doctors also want to change. And we partner with doctors that want to change the face of optometry. So by bringing in doctors that have the same ideology of where optometry should go, we're able to incorporate these equipments into our practice so that it becomes a money generator, but also helps patients. So when they come into our office, it's no longer, oh, wow, I didn't think that I could just get my dry eyes fixed here, or I could get aesthetics fixed here, right? I'm not fully an aesthetic practice, but we do offer dry eye treatments that also gives an aesthetic benefit to it.
Of course. So you brought this in, and then what does it take? Are you taking time to train the doctors on it? Are you taking time to train the staff on it? Yeah. Also, then how do you look at, if you don't mind sharing, look at the numbers to make sure financially it's a good decision for you to bring it in?
Thankfully, partnering with the right companies also, you said developing deep relationships. So a lot of this decisions that I make, and this too, being in the industry, is partnering with companies that also want to change. And so we're able to come together and say, hey, together we can partner and we'll get decent pricing, or there's so many ways of business negotiations that will make it easier on a business to bring in equipment in. But we do train all the doctors, we train all the staff. I spend a lot of time, managing multiple clinics, is seeing from the outside how we can make practices better, and then showing doctors numbers, right? Numbers are powerful.
Right.
And you could say, hey, I feel like you're not doing this, versus you're 30% lower than your peers, right? How can we help you? And if we help you, you can actually make more. So I think the numbers part and having doctors understand what their output is from a numerical standpoint is has been so valuable in us being able to generate that
So
growth.
that's so interesting. I've heard other clinic owners like who have big practices and they have 6 or 8 or 10 ODs working under them. How many ODs do you have across the board?
About 25.
25 ODs. That's incredible. I don't even know how you manage that. We have 5 or 6 between the practices, 6 or 7 between the 2 practices. And I'm like, but I don't do that. I don't share the numbers. I just talk to each one individually. But I know other people will speak. They say it's actually really valuable to be more open about the numbers, and it actually helps to build more trust with the OD that you're not hiding anything. So I think that's something I need to get into a little bit more.
No, the numbers are great. And as doctors, we deal with numbers all the time too, right? When we're trying to tell a patient, hey, I want you to do this treatment versus that treatment, it's been more effective by X percentage or not. Patients think that way, right? When we talk about diabetes in the US and we say 3 out of 4 patients are diabetic or will become diabetic, those are numbers that patients need to hear.
Yeah.
So why can't we use those same numerical values to help grow our doctors in our practice, right? So looking at different areas of opportunity for us and looking at it from a number standpoint has been really helpful.
One of the things that I talk about in general when we're talking about any kind of specialty that we're trying to bring into our practice is you said it already, I just kind of want to highlight this again, is that having a plan and having systems in place and protocols in place is more important, in my opinion, than even the equipment itself, because you can buy the piece of equipment and it'll just sit there and collect dust. Or you can say I'm a dry eye doctor or a myopia management doctor, but nothing gets done, or it feels like everything's kind of chaotic and haphazard because you don't have the systems in place.
Yeah.
I highly, highly encourage anybody who's trying to get into any kind of specialty care that you take the time to develop those systems.
Yeah, and I would say even develop the systems before you buy the equipment.
Yes.
You can learn about the equipment, but develop the system, develop the protocol to the T in terms of the flow before you purchase an equipment or start to do a new service. That'll make your life easier. Your assistants won't be questioning, hey, what am I doing? And everyone will have kind of a clear understanding. And best of it is that patient will actually get good care rather than, why don't we bring you back and then no one knows what's doing it? And that's a poor reflection of your business too. So
that's amazing insight. Thank you very much. Again, I think we both really want our colleagues and our friends out there to succeed. And we want our profession to grow and succeed. But it's going to take effort, right? Like everything does. It's not just a plug and play a lot of the time. So I appreciate that insight. Okay. So you're in the thick of it. You're building all these relationships, collaborating with industry. You get to see kind of what's up and coming, what's new, what's exciting, what's a little scary, maybe even. What do you see coming right now that you want our friends out there to know that's about to kind of hit the industry in the near future, or is already here that we're not seeing?
Yeah. So honestly, I think this is one of the most exciting times in my career, in my short career of 10 years. The next 5 years, I believe in optometry is going to be so different in how we practice. And this is already here. And this is not just exclusive to optometry. It's everywhere, right? We're talking about AI. We're talking about, kiosks. We're talking about telemedicine, right? So 5 years ago, we talked about telemedicine. It was already there and we're kind of seeing it and we're seeing the downfall of telemedicine. But now we're seeing kiosks happen. And that's going to be very interesting, the use of AI and kiosks in optometry.
Can you elaborate on kiosks? Because even for me, I'm like, I think I know what you're talking about, but what are we talking about?
So I think we need to all start, there are already companies out here, kiosk companies that are offering different care, whether it's on the disease side or the refractive side.
So just like standalone
kiosks
units,
where you stand in front of it and
and they do a refraction or they take a photo.
Take photos, check the pressures. So all of this is already here. It's exciting. We're going to see how the next 5 years, how these will have a space in our optometric practices and how we have to stay ahead of the game in whether implementing these, because patients want them, consumers want it, consumers want convenience. So that's going to be really exciting and interesting and scary, right?
Well, yeah. So my first thought is, in the beginning of this conversation, we're saying we need to change the public perception, because right now the perception is we are just refractionists.
Yeah.
And then if you tell me that there's a kiosk in the mall where I can just go get a refraction, so that seems like all of a sudden the optometrist is out of the equation.
Which is why we have to change that narrative, right? Yeah. Which is why we have to start saying, we're more than just refractionists. There's going to come disruptors of kiosks and AIs and telemedicine and online refraction systems where it's going to take away that patient to in-person care, or take away from us being doctors rather than automation. So this is exactly the point. Every optometrist needs to look in their practice and see, the next 5 years, how can I adapt my practice within society through the use of AI? I mean, we have, Elon Musk just said that he's bringing in personal maids in your house, right? So, I mean, nannies, cleaners. So this is happening. The change is happening. It's happening within optometry. I'm excited to be a part of it and kind of start developing and making sure optometrists are part of that change.
Okay, that's important. Like you said earlier on, right? We need to be at the table. We need to be part of the conversation. Because otherwise, yeah, kiosks in the mall is not something I think most of us are going to be too excited about. But if we can be somehow involved and understand the technology and leverage the technology.
And how we can build businesses, right? So sure, it can be in a kiosk in a mall. You know, the way that I explain it is the blood pressure cuffs in CVS doesn't take away your primary care need, right? It just enhances and elevates that need for the patient. So these kiosks, whether it's telemedicine, whether it's online, whether it's, you know, an actual screener, they're going to help feed our practice. So where could we fall in line with these new changes happening in industry? And I think a lot more of us need to be part of that discussion and not afraid of change, but be part of that change.
Yeah, I think that's the case across the board with all new technology, with anything that's coming up. We need to embrace it rather than be scared of it. I think I talk a lot about, like, if you rewind the clock 10, 15 years when e-com was starting to become a big thing, like most of us kind of just buried our head in the sand, and then it just washed over the entire industry. But we can't let that happen over and over again. So we need to be on top of it. We need to embrace it and learn about it. So I appreciate that. There's two questions I like to ask. I'm going to ask you at the end. They're more personal questions. But before we do that, how can people find you and learn more about you?
Instagram has been great. So people, you know, patients, doctors, staff, everyone that wants to follow me, they can follow me on Blinking Out Eyecare on Instagram, LinkedIn.
Perfect. Okay, the two questions I like to ask are, like I said, a little bit more personal questions. The first one is, if we could step in a time machine and go back to a point in your life where you were having some difficulties, you were struggling, it was a hard period of time, what advice would you give to younger Faten at that time?
You will make it through the darkness into the light. That, you know, a lot of the times when you're stuck in a position, you think that's it. But I wish I could say, take a deep breath, you're going to make it. And I think that's something, as we get older, we realize, so things don't scare us as much anymore. And, you know, a lot of people are like, wow, you're so cavalier about this. No, it's just because I learned to follow my gut, and I learned to say, hey, you will make it through this part, right? There's ebbs and flows and everything. So I would say, if I went back 10 years, and I would just tell the younger Faten, it's okay, shed your tears, but you will come out of it.
Okay, I love that. This too shall pass, right? Is like
this
a common
too shall pass.
I like that. That. That's so important. I think that so many times we go through things, we have to, when we're in it, we have to just remind ourselves that this will pass, we'll grow from it, usually. So that's great advice. And from somebody who's built as much as you have and done as much as you have, I think it's important for anybody else out there listening who may be going through a tough time or will at some time know that you were able to get through it and grow. So that's great. The last question I like to ask is, of all the things that you've done so far in your career, all the success, how much of it would you say is due to luck and how much is due to hard work?
Gosh, I get this all the time. I get really bothered when people are like, you're so lucky. It's like, man, if you only knew the sacrifices, and if you only knew, so I don't believe in luck, right?
Okay.
I do believe in hard work, and I do believe in people that take the risks of putting themselves out there. And I do believe in embracing failure. Was I lucky that I got certain things? No, I think I just constantly looked for different opportunities, and I constantly looked on how, if I had an idea, how I would change it. So I've actually been, as if if we really talk about luck, there's been a lot more unluckiness. I've had so many failures that we don't talk about, right? There are, on top of it all, there's so many failures, and maybe out of the 10 failures, one comes to shine as a success. And so we shine light on our successes, right? We try to hide away our failures, but there are so many failures that we don't talk about.
It's an interesting point. I feel like
I've been more unlucky than
yeah, I get it. I totally understand. I'm the same way. It's uncomfortable or awkward or weird to talk about your failures, but I do think it's important that we mention that we've had them at least, so other people know that it's not, you weren't just born, bright and shiny and successful business owner. You had all these things that you had to go through, including a lot of failures.
Listen, I'm an immigrant. I moved to the States. I'm Iranian. I'm an immigrant. I moved to the States. So I've had every barrier in front of me to kind of stop me. And so I just said, no, we're going to break barriers. So hopefully we continue to break barriers in optometry too. And
I think that's the theme of this episode is breaking barriers.
Yeah.
All right. I love that. Thank you for sharing that. I appreciate it. I want to say a big thank you to Chivetta again for supporting this podcast, but also for bringing ODs and industry together so we can all grow and collaborate together. But big thank you to Vision Expo and for having this beautiful backdrop. If you're not watching, tune into YouTube, watch. We look pretty good. Like we're dressed pretty nice. And there's a nice backdrop. Thank you to everybody for listening and watching to the 2020 podcast, Canada's #1 optometry podcast. I'll see you guys in the next episode.